Hey there, Dr. James Fedich from Bulge Family Clinic in Hackettstown, New Jersey, talking about spinal disc bulges and disc herniations. Question I get often asked in the clinic here. Get a little quick anatomy and some information for you. So we have all these bones of vertebrae, 24 in the spine. In between each one is a little disc that we have in between there to be our spacer and our shock absorber for everyday movements. I tell patients this is a lot like a jelly donut from the donut store. We got all these fibers that hold the jelly in. Now, a couple things that happen with these discs, so we can have a disc bulge or herniation. So technically a bulge is where some of that disc is pushed out, but it's still within that donut. And a herniation, if we're being technical, some of the jelly actually comes out of the donut. Now, one isn't necessarily more painful than the other. Disc is one of the only parts of the human body with no nerve supply and no blood supply. So the disc itself doesn't hurt. When people say my disc hurts or slip the disc doesn't feel any pain. You can stick a needle in there, you wouldn't feel it. It also has no blood flow. So if they do get injured, they do not really heal on their own. Unlike when we cut our skin, it bleeds. Discs aren't going to really naturally heal. So if we get some trauma, or with most of these disc injuries are just a lot of little things over time, some of that disc material can bulge or slip out of there. If it rubs the nerve, it can be very painful, causing shooting pain, numbness, tingling, burning, and all those sensations. So this happens, there's a couple treatment options available to you. You can take some pain pills, numb it a little bit. That doesn't work all that great. Do a needle injection. People ask about that a lot. They'll take an epidural needle. They'll stick some cortisone and lidocaine in there and numb the nerve a little bit. Hopefully takes care of some of the pain. We can also do spinal surgery. They can take that disc out. Fusion surgery is a major surgery. We'll actually cut the back of the vertebrae off and stick rods and screws in there to fuse it together. What we do for these here is spinal decompression. That's the table I'm sitting next to here. And these tables are able to gently traction or suck that disc off of that nerve. Now, years ago, we put patients in traction for these things. We'd go to the hospital for 10 hours and pull on the spine, trying to distract that disc off there. The idea was good, but we found the body doesn't like being pulled for hours at a time. So what we do now is you do it in 15, 20-minute increments over a series of time to gently pull that off there. The other advance with just plain traction, like you might see in a physical therapy office, is just going to pull on there and hold. But what non-surgical spinal decompression does is it pulls, holds, relaxes, pulls in a very controlled pattern by a servo motor and a computer. It's able to not only pull that off there, but the pumping motion allows the disc to rehydrate and heal a little bit. So discs only heal when they're moving, and when they're injured, they're not moving. And the table's able to pump that a little bit, get some fluid in there and rehydrate the disc. So if you're anyone who has a bulging, herniated disc, slip disc, anything like that, there is non-surgical, non-medication help for you. Just give us a call or text at Village Family Clinic in Hackettstown, New Jersey at 908-813-8200.